Perfect. So, Carol is director of our partner organization, Medica Liberia, a very active organization working in Liberia since many years. And I remember when I first met Carol, that was in 2010. And by that time, we as Medica Mondiale, we were running a big program in Liberia. And we were just about to think of turning the whole program over to the Liberian women. And by that time, we were searching for a director or potential director, and it wasn't easy to find somebody who has both the political mind and the brightness and the leadership skills. And then our then program manager, Anu Pillay, she said, "Oh, there is just somebody that I know arriving today at the airport. She had a master for 1 year in Uganda, and she just arrived." And I think, Carol, you were just arriving at the airport when Anu was calling you and saying, "Come for a job interview with Sybille Fezer and Monica Hauser because we are needing you to lead our organization." So since then, 10 years passed, and Carol was first deputy director, working together with Anu for some years, and then she took over. And since then, I think the organization really became better and bright and is so active, and one of the most, I would say, one of the most active and political women's organization in Liberia, both doing a lot of work in communities in Southeast Liberia and in remote areas around Monrovia as well as political work for better laws, for improvement of laws, for domestic violence law, for a better life for women in Liberia. So this is Carol, and I'm happy to talk to you today.
I'm also happy to talk to you, Sybille, after working with you for many years, 10 years, being at Medical Liberia. So Sybille is now the co-executive director at Medica Mondiale. Before then, she was the program manager for Medica Mondiale Liberia. So there we worked very closely. So from the start of my recruitment process and then coming to work on an everyday basis, implementing a very large donor funder project, like she mentioned, in southeastern part of Liberia, and then we then extended the program to include urban communities, urban part of Liberia, because there was a dire need for the kind of work that we do, providing direct services to women and girls who are affected by sexual and gender-based violence. So this is how our collaboration started ever since, and then we kept the ball rolling, and here we are today, 10 years later.
10 years later, and I just think a few weeks ago, I think 2 weeks ago or so, you were contacting me, and I was really very emotional about it because you were asking how we are doing here in Germany with the corona virus spreading, because you have been reading the news and you saw that our area here, our region, is very much affected. And somehow I I think it turned a bit the thing around for that very moment, at least, because during the Ebola crisis, we've been on the Skype almost every day, and I was so worried about Medical Liberia and about you all and about the colleagues and the situation. And we were on Skype almost every day. And now, this time, you asked me how we are doing. That was really a special moment. So maybe we can share a little bit about how our organizations are dealing with the Corona crisis, how you are dealing with it in Liberia, what are we doing in Germany, and what is Medica Mondiale doing to support our partner organizations around the world. So I don't know, maybe you can start because I know you are already in the prevention loop.
Yeah. So I think as a country, Liberia was a quite proactive in the sense that even before we had any outbreak of the virus, the airport screening had already started. And I think this comes from the learning from the Ebola epidemic. So 5 years ago, 5, 6 years ago, we were crushed deeply with the Ebola virus disease, and part of the learning still is with us. Again, is very traumatic. So sometimes because of that, people may forget, but immediately the government, through the airport authorities, started airport screening. Although I want to say that that was not very strict, because that initial plan was to be able to scrutinize passengers that were coming to the country and be able to screen them and see whether they were suspected cases, or so that they could be allowed into the country, which was a brilliant idea. However, there were lapses in between, which then led us to now, by the 16th of March, we recorded the first case of coronavirus in the community that our offices is located, medical Liberia. So currently there's lots of fear, lots of panic, anxiety, as is with crisis situation, misinformation, rumors, different kinds of messaging around what the coronavirus is, what it is not. The government has been able to put into place a measure, which I will speak to later. So as an organization that's providing support to women and girls, we felt that it was important to be able to respond to the crisis. So immediately, I think it was just like a spontaneous, response following the news from other countries months before the coronavirus hit Liberia. We could already have some measures in place to say, okay, what do we do? So one of the first things that we were able to do was to provide sanitary kits to the community that was firstly attacked, or where it was firstly recorded. And then we provided a bit of training to the community leaders, the clinics that were there, to say, look, this is the virus, this is what you need to be aware of, and this is how, because in that community it's quite populated. You have a bus and a taxi station, so you have many people who are routing in between the community, and you have a market there, so lots of women are there who on a daily basis are in and out of the market, either with their children or just going there on their own. So as an organization, these were some of the initial steps that we have taken. And as we go along, one of the things that we've managed to do is also, which is very critical, is the flexibility of the donor. So in such crisis situation, you need the donors to be much more flexible, much more understanding in terms of the needs of the context that you are working in. So we were able to get one of our donors to approve to say, look, you have to go ahead to be able to realign the current intervention to be able to address issues of women during the crisis, but also provide some support to the coronavirus outbreak. Yeah.
Hi, Carol, and the team, are they still going to the communities, or how did you reorganize your work at the moment? I mean, you are distributing, I saw pictures that you sent me distributing sanitary things, but how are they working?
So because of the different mode of transmission of the coronavirus, we tend to work in a different fashion. So some of the staff are working from office and some are working from home. So for example, the counselors will provide online psychosocial support to women who experience sexual and gender-based violence, domestic violence, all of that, issues affecting women during crisis. They're going to do that, but they're also going to provide online support to people who might be having psychological problems because, either their family member is being taken away or their families are quarantined, and it's quite stressful for you to deal with not knowing what's going to be the outcome, of the test that the person is going to take. So these are some of the things that we're doing. As we do all of this, like we did with the Ebola, we are quite mindful of the risk that is involved. So we do have all the risk measures in place. For the community engagement, we're still trying to talk to the National Health Response Team as to what is the plan, how can we collaborate, how do we make use of the media to be able to put out what are the preventative messages, how do people get contract the virus, what you need to know, what is important for you to do, what is not important for you to do, also what are the myths and misconceptions, the different rumors, so things like that. How do you do messages around social behavior change? How do you make people understand that it is important for you to come forth if you have these symptoms? But people need to first understand that these are the different symptoms of corona, and if I feel this way, I need to go voluntarily for testing, because in that way, I have a higher probability of surviving. So that is also the whole stigmatization of the virus. People, there's different, reaction to people who, when they get either they're tested or a family member. So how do you work with communities that they become much more engaged, much more involved? Because again, these are learnings that we had from the Ebola crisis. Communities were very robust, providing guidance to their communities, serving as like a backstop to their community, so that if there were new entrants, if there were new people coming to the community, they could liaise with the health authorities and be able to say, hey, we do have a new person here. Can we self-quarantine this person, quarantine the person and be able to monitor and see how he or she feels before we can allow his or her to be welcome into the community. So there's a lot of role, for women organizations that are around the country to be able to provide that kind of experience from Ebola. I don't want to get so much into the politics of that, but I think this is crucial for all stakeholders to get on board, to be able to provide the kind of collective engagement, collective support that we all need to ensure that our country the virus is contained in our country.
Yeah, and I think you are so well posed to do this, well equipped to do this, because through the solidarity groups that work in the communities, you have already such a good entrance. You talk to the authorities, you are well known to the health people in the communities, because I can imagine, I don't know whether you remember that case when in that community in River G, the local authorities, they were getting chlorine from another international organization, and they thought this organization is bringing the Ebola. And I remember how they went around and put the chlorine around their village to protect the village from the virus. And then by that time, Cheryl Jean, our health worker, she went there and she explained everything properly. And as she was so well known and trusted by the communities, she really made a difference. And I experienced this at that time a lot, how this entrance point and that trust that you had built was really a big advantage. I mean, the international help was very important by that time, but to really ground it into the local realities, I think Medica Liberia was very crucial. And everybody knew also in which houses there are women who are under quarantine, who don't have anybody to help them. I think, we will talk about the Ebola later. I think that was really an important experience that you had as an organization that helps you now during the Corona. Yeah, and for us, as you were asking before, in Germany, we are one of the hot spots here in North Rhine-Westphalia, and all the offices closed. Almost everybody is working from home since like almost 3 weeks now. And I'm also saying thanks to the team of Medica Liberia. I know that a lot of them certainly are now watching also our talk, because everybody is so much like really engaged, trying the best to work from home and supporting our partner organizations around the world in their now important work to prevent help preventing the virus and to also help mitigating the consequences for women and girls in all those communities. So our team of international projects teams, they are very quick now in supporting the partner organizations. Almost every day they are on the Skype with them and on the phone and try to see how the project activities can be adapted. And of course, they take a lot of good examples also from what you have already been developed during the Ebola crisis. And we have been setting up an emergency fund now for all our partners, so to help them with very essential issues, as you said, to buy chlorine and to do prevention work. But also what in many occasions is also needed, to have mobile phones, to be able to communicate in another way with the women and girls they normally work with, which they are not kind of able to do it in the normal manner anymore. And also I know that is something that is always very much needed during that time, is to help the helpers to develop material and to support organizations like yours and our partners around the world to cope with the crisis and to have also some stress release and things like that. So our team is our trauma team here in Cologne is working on this, and our communications and fundraising teams, they are working to try to get funding for these activities because they were not previewed. So everybody is kind of really busy, and we are trying out all these different, online formats to keep in touch with each other, to have cheering up mails every morning with a little song where everybody feels connected. So this is kind of how the situation is here in Germany, and I think. Nevertheless, we are passing difficult times, but we are still privileged with regard to many other women here in Germany who know about. We have colleagues who support the work in refugee homes, and there the situation is much worse. So the women who live there and the men, they are confined in a lot of people in small places, and and some of the refugee homes which we support, the virus broke out, so you can imagine how the situation is there. So still the team keeps spirit high, and
so I think the point about the trauma work from Cologne office with the trauma department is quite helpful, and this was also some of the collaboration during the Ebola. So the self-care for staff, but also the health workers, the debriefing for health workers, for survivors was quite critical. So I had a conversation last week with one of the doctors who was on the Ebola, who works in the Ebola treatment unit, and was asking him about this idea that I was discussing with Caroline about debriefing for health workers. Although currently he's not part of the Corona response team, he's doing just his normal medical doctor work. But he's like, by the time, he said to me, Carol, by the time the outbreak was announced, that one case was announced, I had a relapse immediately because he just saw himself back, in the hospital treating cases of Ebola. So he just saw him. So also the workarounds for health workers so that they're able to cope, because there are a lot of challenges to go into the health facility every day. Yesterday, the debriefing from the National Public Health reported that there were 661 contacts of the coronavirus, the contacts, not the cases. And from that 661, there are 68, so there are 78 health workers who are contacts, meaning that they have come in contact with some positive cases. So that is already alarming for a country that our health force is have challenges in terms of the number of persons who are there. So that already speaks volume as to how well prepared they are, whether they have the correct equipment, whether they have the psychosocial support that they need to be able to be mentally, stable to be able to treat a patient without, fear. So there's a lot of other issues. So I'm glad that you brought a point about the debriefing for health workers, but also for staff, because going on the front line or being quite involved in such response is it felt on you. So there's a lot of impact on your well-being. So that has to be of concern. That has to be taken care of. So what I like very much is the solidarity between us, but also the solidarity with our Liberian sisters amongst our networks, among the women groups that we're working with. That is very critical. I know, for example, I talked to Carter Williams, to Action A team, like every day. So we're crying together, we're laughing together, we're discussing program interventions and how we can improve here, where the gaps are, and how we can strategize better to provide the kind of strategic, support to the containment process.
Mm-hmm. Yeah, this is very, very important, as I said, to keep connected. And I know that our colleagues, they connect to each other too, but they connect to the partner organizations. And I think we are all we are of course watching the numbers rising here in Germany, but at the same time we are always looking, these tables. We look at the African countries or the countries abroad in Afghanistan, in Iraq, where we work, and we look at those numbers too, because we know even in Southeastern Europe, the number of beds and treatment units and so on is so much lower than here in Germany. So we are really kind of hoping that the virus wouldn't spread so much in countries where the health system, I mean, we do have one of the best health systems in the world here in Germany, and yet here also the people are already stressed, and we know from Italy and from Spain, European countries with much better systems in place. And I remember during the Ebola crisis how many doctors and nurses died, right, during the Ebola, and that in a country where you don't even have lot of doctors in general. Yeah. So maybe I was thinking we could remember a bit, and we could share also with our community, because I know for sure some of our partner organizations will be watching too, share a little bit of what was very important during the Ebola crisis in terms of how you worked, what you did. I mean, you mentioned a bit of it already, but maybe we can dig deeper into it.
So I think so when the Ebola virus was reported in Liberia, we had no idea of what that was, right? So this was new to some of us. This was the second outbreak globally, but for Liberia, this was the first outbreak, and many of us didn't even know about what was called Ebola virus disease. However, with the spread of the virus, it was concerning. It was there was a lot of just it seemed kind of similarity to how people are reacting to this outbreak. So for different organizations, there was other civil society networks or women's organizations coming together to say how can we, as using our community-based experiences, how can we, given our different expertise, support the government to be able to. So that, for example, there was a Ebola civil society task force set up that we tried to work with. Medica Liberia also did a number of other initiatives, and I also was really want to acknowledge the donors who were quite understanding to say, look, I think what is important, because it would sound really crazy if we just shut down. We say we have a health emergency, health epidemic, and we all go home. And then after the crisis, we come back to the women and say, hi, we want to talk about domestic violence. But meanwhile, where have you been? So some of our donors, for example, the Swiss development, as the Swiss were quite helpful. Our donors from Sino, the Pro Victimis and Medical Foundation were very, very instrumental to say, hey, this is possible. We can give you a quick approval. You can realign the program to address the community engagement, the support to the health sector, be able to do the kind of work that is quite important now. So for me, that was the first thing, because without that, you cannot do what you want to do. So just by having donors who were listening to us to say, look, these women want to do X, Y, Z, and we see that this is much needed in the communities, and so we're giving them the flexibility to do that, allow us to do the work that we did. So some of the engagement that we did were around, of course, providing hygiene kits to the communities, to the health, to the hospitals, the county health offices. In fact, we have received already requests from some of the CHD. I'm not going to mention now, but we were already providing whether it was chlorine or whether it was just hygiene materials,
I remember.
gloves, gloves, so the health facilities, and also I think one of the other things was around the homes that were quarantined. A lot of work went into making sure that if we knew of, because through the community engagement, we found out that there were suspected cases, and then we will provide food, we'll provide basic supplies to the extent that if there were women in those homes, we'll provide menstrual pads, we'll provide underwear, just what was important
all those
for the
things
women.
that normally
Everything,
about, right?
In fact, to the extent that we even provided charcoal, fire coal for them to put, and matches that they will strike, because they were not allowed to come out for 21 days. And so everything that they needed for those homes that we worked with in those communities that we were working in, we provided them those important materials. Also, just the messaging, doing community engagement, telling people about what the risks are, how to prevent it, was quite helpful to give community leaders who we were working with, our support group women, to understand in very simple Liberian English how they could get involved and how they can. So in fact, from one of the trainings, I remember one of the women had gone into the community and they were asking them to bathe with salt water, and then they would be killed from Ebola. They will not contract Ebola. And she said, no, I went to medical Liberia training. And this is what they told me. They said that if you can get Ebola through this means, we mustn't bathe with salt water. So she could already have that information and be able to use it in a positive way to help our community to understand what it meant, what you needed to do to prevent yourself from contracting the virus. We also did the debriefing for health workers who were on the front line, who are in the facilities. They would come and sit together with our counselors and talk about their experiences and be able to come up with coping strategies for how they would go on about their daily work, in the different facilities that they were working. That was really useful.
Oh, this I remember. I remember that you were sending me some of their statements, how they were like so much relieved because nobody was thinking about them. They were on the floor, like really all the day working and seeing people dying and ill people, and they were sitting together and with our counselors. I remember how that you sent me some messages of them, how they felt relieved to have a space for themselves, to see how it affects them, and to stay a bit healthier during that crisis. And Carol, do you remember? I was just, when I was now thinking about the Ebola crisis, that one day when you were like calling me, almost crying. We were almost crying together because there was a woman who was giving birth at the street. And you and your colleagues, you were standing around with lepers to protect her from people watching at her. And I remember, and I think that was really the chance at that time that we also got those flexible funds through our women's community here in Germany, who really donated money for our work, because then we were together thinking what could we do, and we saw that the effects on maternal health and on sexual and reproductive health rights for women was so high that women couldn't, that the clinics were closed for women to have natal care, that women's health didn't matter so much anymore. And you found that lady from that private hospital, and we funded her to hire more nurses and to remember. I think that
So that is a case that will ever be in my mind. So I remember that very vividly. There was a woman who, like you said, there was a group of women all standing together near the health Ministry of Health building, and I was very curious. I'm like, why are women gathered? Something must be happening. So we went there, and then we found that a woman was in labor. In fact, had given birth, and a midwife who did not even have, she had been turned down from a health facility because she did not have the money. So she was asked to pay $400, and she did not have the money. So this midwife, who was a good Samaritan, decided that she would do her basic midwifery and help us to give birth. But by that time it was late. When the baby was born, but the baby had died when we got there. The current Minister of Health, Dr. Jala, was running a private clinic. That's where we took the woman. So I phoned her and said, look, we even have to break the protocol that day to make sure that we could save that woman's life. So we put her on a vehicle and took her to the facility, and then left her at the facility through a number of days of treatment. And then Dr. Jala then phoned us and said, this is, the case, what's happening with her. Luckily for her, she survived. She lived, she had tuberculosis and HIV. 6 months later, I saw the woman and I could not believe it. She had come to the office to say thank you, because one of the things that we were doing was to provide support to women. So either they were getting some business or some skills training, they were getting a bit of money to start up a startup kit to survivors. So she had come to collect her part, and she greeted me, and I said hello, and I passed her. And then the driver who was with me, our female driver, whispered in my ear and said, do you remember that woman? I'm like, which is the woman? That is the woman we picked on the street. I was amazed. The transformation in that woman, that one stop that we made.
And I don't know the number anymore, but there were a lot of women that could go to that hospital. And
yes, and then there's the partnership with the Women of Hope Hospital to provide support to their facility, so that there is a special place for women who come in, that they know that there is service, there free service that they can access and be able to be catered to. So that is how we landed that project with Hope for Women, to be able to provide care for women who are coming in the facility during the Ebola crisis. Yeah.
Because I think that was some of the things we experienced very heavily there, that the effects also of the Ebola crisis on women and men were different, right? And that was your response to it, because you saw that the healthcare for women was, I mean, it wasn't provided for anybody, but especially for women giving childbirth. There were those kind of, figures that there were thousands of people dying from Ebola, but many more thousands of people, women dying in maternal during maternity, during childbirth. And I think that was something that I felt at that time. Also, you as Medica Liberia, you had that special view also on what is needed for women, because I also remember that you were starting that help hotline, right? During the phone, I think that Florida at the time, she was like as hotline, because and I think that's something now, Carol, that we are experiencing in Europe too, that the levels of domestic violence is raising a lot. There are first like figures from China, but also from France and Italy, because women are now in quarantine at home, or they are in lockdown at home, and they are and they are home with their perpetrators. Many of the partners, they lose their jobs. They are they're in anguish too. So this is something that we are experiencing already, and that's really not easy to find a good response to it, because many of the women, I mean, I know from people who work in hotlines that the calls are raising, but at the same time, there are also those women who can't even call anymore because they are sharing the room with their with the violators. So I think this is something that at that time you also had during the Ebola time, you had this very much in view. You responded.
So I think it's just the sensitivity to the issues that women face, and being aware that even under normal circumstances, what are the issues that women face? And in crisis time, we know that these issues are elevated, they are increased, so that we're able to program around the different needs of women during crisis time or during conflict time. Again, we come from decades of civil conflict to the Ebola crisis. In fact, we were saying, now we were joking, a friend of mine, and said, look, you know what? We've been through a lot. We've had a civil war, how many civil wars we had. We've had the Ebola crisis, and so we're not going to have Corona. Corona is going to get tired, it's not going to come. this was we said this, we've had enough. We've had
You had
all of
enough.
these, terrible situations. So, yeah, I have to laugh about it, but we were thinking, we're going to be safe from this one because we've had it. We've really had it, and with what our experiences have been, so Corona, no, you're not going to come here. But here we are, 3 weeks, almost 3 weeks, and we have, yeah, up to yesterday, 14 cases, and I think by tomorrow we'll have another update to tell us how many more cases we have.
Yeah.
But again, in all of this, like you're pointing out, is what are the concerns for what are the needs for women. And in fact, in a way, when we have conflict situations or when we have crisis, the women issues become invisible. Even in normal circumstances, we're always fighting to be on the table. We're always fighting to be seated. We're fighting to be heard. We're always fighting. So during crisis time, we fight more. We put a lot of more energy into making sure that we're represented, our inputs, that our issues are on the agenda. I mean, yesterday, when the Minister of Health spoke during the briefing, and then she said, "Oh, the pregnant women," and this was the first time that she's a female, she's a medical doctor, she's a female. This is the first time that anything concerning issues is really mentioned on the coronavirus update. That or what she was raising concern about pregnant women, how the services should still be available for women to access maternal health, and also for critical illness, chronic illnesses, HIV, TB, that those different services they were assuring the public that those different services are still available, and that people should contact if there were need for such services. Again, there's one thing to say that, but then the assurance that those services are operational, are there, that people can access them. Yeah. But again, with all of the misinformation, the confusion, people also get skeptical about going to health facilities in crisis time, how the potential of being or the possibility of contracting the virus, all of are issues that people that tend to drive people away from health centers. So it's really about, I think, trust building, reassuring the public about the different services that are there, and making sure that they're available when people come.
And I think it's not different in Liberia than like everywhere in the world. I think according to the World Health Organization, 70% of those who work in health, in old people's homes and so on, are women. So as you say, also in Liberia, like there are people not wanting to go to the health centers in fear, but those who work for those kind of crucial services are almost all the time women. So I think it's a very gendered crisis. We say the virus is hitting everybody equal, but in fact we don't have the equality. I think it's like a Zoom class on. And you see all the divides in society even harder. You see the gender thing, women working in not so well paid job, working on the forefront, having the care at home, taking care about the old, taking care about the children. You see this. You see refugee women or refugee not being, not having the same rights, not being confined to one place. You see those who are poor. You see, I don't know about Liberia now, but we hear from other organizations that even now there come very racial elements into it. For example, in Georgia, they are now saying the virus is being spread by homosexuals. Can you believe? I mean, in such a crisis, you see really how these inequalities are exacerbated.
I think it's evident that women are proportionally affected. So more women are affected, either socially or economically, like you're mentioning, the unpaid care work down where most people or people have been asked to work from home. So as a professional woman, you have your office work to do in addition to, so all of that are issues that, so it's all the whole issue around. So what it does is that there's also the overlapping of vulnerabilities that exposes women to further inequality, as you're mentioning.
Yeah, I think it's the same all over the world at the moment. Those inequalities, and then you have the global north and the south, and the different possibilities in access to healthcare and so on. Yeah. So what I see is now very important for us in Medica Mondiale to take from all these kind of materials that Medica Liberia at that time developed, the methods for counseling on the phone. Even I think your team at that time learned grief counseling, which was very hard to do, but they learned how to do it because so many people died. And now we are in contact with many other organizations with Immaculée from PAIF in the DRC, in the Congo, then with Godelieve in Rwanda and so on, to transfer some of your what you developed, to share it with them. And I'm sure they are already contacting you also to hear from your experiences. Yeah.
I mean, that's the solidarity, that's the exchange, the exchange learning, the solidarity, being there and be able to exchange information, let's share lessons learned, so that we, in the end, what do we want? We want a better world. We want to be able to improve our community. We want to be able to improve the situations of women and girls. So if it means that we share our experiences, this is something that we are open and we're happy to do. We also learn from other people. We're even on the ground. We're talking to our other colleagues outside of Medica Liberia as to what's happening, and that also informs the work that we do.
Yeah, that's really important. Let me just see what we could still share with our communities. Oh, I've just got somebody saying we have still 15 minutes to share. So I don't know what you can share about the work in Southeast Liberia, in the rural areas. Did you already prepare there as well? Or is it such a problem at the moment?
So in Southeast, so right now the outbreak is in Montserrado and in Margidi. So for those who do not know Liberia, these are the urban parts of Liberia. So two counties where we're having the first cases of coronavirus. About on the 21st of March, the government of Liberia, through the Ministry of Health, made a proclamation. So this proclamation now allows for the government to restrict the movement, to restrict mobility, and be able to contain the virus. So the schools are closed nationwide, for example. Large entertainment centers, large gathering, religious activities have been banned. And in fact, for small gatherings, what is allowed is 10% maximum, and then you must allow 6 feet. So every time we have an outbreak, so social distancing is being encouraged so that we all can, so that we don't spread the virus or so that we don't contract the virus. So that is, so this is now in, but also, even though the virus is in Montserrado, it's in the urban part. Yesterday there was a report. I'm not sure how confirmed this is. There was one newspaper that reported that one of the suspected cases had fled from the urban part of Liberia to the rural part. So there is a high probability. Also, the southeast that we work in, there was one suspected case, but then after testing, it showed negative. We do have borders with like Cote d'Ivoire, Ivory Coast.
There are a lot of cases in Ivory Coast already, right?
Yeah, so the border management, even though our airports are closed, the border management is crucial for monitoring and to ensure that we do not have cases coming through the border post. So the southeast is located around the border area, and so far we do not have any cases. But again, we say well, prevention is better than cure. So we are in negotiation with one of our donors, the German Development Bank, the Germans, to allow us to be able to do some prevention work in those communities. But also in Sino, where we also work, we do have some bit of support to allow us to provide some community engagement and some material support to the county health teams. So we will be starting soon with that.
What I wonder, Carol, knowing a bit of the reality in Liberia, what do women do if they are like if there's a lockdown and they can't go out of their houses? Because it's the women who bring the money, who sell things on the market, who carry the water, who go out to bring some food into the house. So what are they doing? I mean, how are you coping with
So we do not have a full lockdown yet. I mean, this is we do what we have is a partial lockdown. So we're allowed to go out, but it's stopping you. But large gatherings, but again, the marketplace. So the market is a large gathering place. So far, the police have been trying to remove people from the market. Some of them have become violent, I must say. There's no kind of structured way how the police or the health, whoever is in charge, to engage with the marketeers to say, okay, can we do like a rotational basis for some market persons to come today and sell their produce? Because we also understand the income dimension to that. People need to sell every day, the poverty angle to that. So how do we make sure that people can come out and sell and be able to feed their families, but without putting themselves at risk? That is very critical. Now the lockdown. The lockdown is something people say is privilege, but again we have to put our it's a big risk not to lock down. So it's a whole we can have a whole argument about what are the disadvantages and advantages to lock down the country, being mindful that we're all not at the same in terms of wealth or income or status, but also because some of our communities are overcrowded. People live in maybe 10, 15 person live in one house. The access to public water, for example, so that they're able to wash their hands clean, access to soap, all of those basic things that you need to have. The question is, do they have them? But the bigger question is the government thinking about how to support these communities so that they can have some other access, so issue around livelihood, food security, whether they can have some basic supplies that we can lock down, contain the virus, because you can lock down and then people
Yeah,
start to
yeah, and I
starve.
remember
But again, we
that
have
was
to look at,
exactly what your team was doing during Ebola
but we also have
to
to see,
see.
we also have to assess the
Yeah.
situation. The public health expert need to assess the situation given the caseload that we're coming out and say, look, these are the different options, for us. If we lock down, these are, the different. So that kind of scenario has to be thought through carefully because we also do not want to, for example, people cannot access other health services because we
Mhm.
lock down. I'm locked down. Somebody is locked down. They cannot go to hospital and die from malaria,
Mhm.
for example. That's or die from giving birth. They don't have the access to
Mhm.
so there are different. I think there are different things to consider that before we lock down. But again, we have to look at, I think, the bigger good, because of the way how we've seen the virus spread across,
Mhm.
countries is been unmanageable. We do not have the capacity to do that. So this will be, I think, in the view of, it should be in the purview of the health experts to say, look, these are our chances, and make
No,
that
and I
decision.
just wanted to say this was exactly what I remember your team was doing because they knew so well the local communities that they knew which family which is locked in the house and under quarantine would have no access to any food or anything. And so I remember you telling how no, and sending pictures on how they kind of
Hmm.
put the food there, carried the water there,
Yeah.
let them pick it up and bring it into the house. And these are things that the authorities weren't able to really follow up, and even the international organizations weren't so deeply into those communities to really know the realities that were there, which of the women were like disabled and couldn't come out of the house and so on. And I think this kind of community structure which you have in place, and many of our partner organizations in the Great Lake regions of Africa, in Congo, in Rwanda have in place. This is such a huge asset in such a situation to really be able to provide help where it is most needed and to know how the local communities function. Yeah, yeah.
Okay.
Question from Zambia.
Ah, okay. There is a question from Zambia coming, Carol, to us.
Uh-huh.
In rural areas, it is very difficult to explain difference between Corona and Ebola. Do you have any
Yeah.
idea or experience?
So, like I said, the corona outbreak is just starting. So there's a lot of there's not much. A lot of information is already coming out to the communities who do not have. Of course, what the way to present it is that it's a health outbreak, so people understand the health outbreak. What is important is to distinguish between the different ways in which people can contract the virus. So the way you contract Ebola is different from how you contract corona. Also, the prevention measures has to be really explained to the people. Again, make use of the local languages, vernaculars, so that people can understand. Make use of different communication techniques so that people can get the message for what they need to do. I think that is really critical. So Ebola is there. Use the local languages. I think people understand it and they can much more relate to when they hear it in their own languages.
Thank you,
Okay,
Carol.
ihr könnt es losgehen.
Okay, my colleague Helena is just saying that the hour is already over. I know we could talk much more, as always, and also share some nice things about friends and families and so on. So I hope that everybody is fine in your house. And in the team of Medica Liberia, I think, I don't know how you feel about, but I feel really proud about Medica Mondiale team, who we have great colleagues who work together in solidarity now and try to kind of really raise funds and resources and support our partner organizations. And I know many of your team, there are new ones, but I know a lot of them already from the time when I worked for and in Liberia. And I know it's such a, yeah, it's a gift to work with women in women's organization, feminist organization who are out there and when the crisis hits and are there to support each other, right?
Yeah, I think it makes a difference. It do make a difference for the kind of solidarity to have courageous women, women who are passionate. I'm working from home, and they have to commute. We organize transport from the office because we don't want them using public transport, and then they are going, on the schedule. And sometimes I went in the office last week and I met them, and I'm like, we are supposed to be closed at 3 o'clock. So what are you doing? Oh no, we have to finish this. We have to finish that. So
Yeah, I'm getting
So,
messages from colleagues at weird times because, of course, many of them are with their children home, so they can't work the normal hours. So I get messages at
yeah,
10:30 in the evening, but it's wonderful to see how everybody is kind of really saying now we have to make a difference for women, for the world,
uh-huh,
to struggle
yeah,
together against this crisis. And
yeah, and also with the team, our Liberian team, Lucia and Daniela, Catherine. You can just now we have WhatsApp. We didn't have WhatsApp during the Ebola
true.
crisis. So we can make use of other social media
The team in Cologne. Yeah.
platforms to be able to communicate more effectively, uh, even without being in the office. I think so. It's great that we can just say, hey, can we talk? And then they're coming. They're quite supportive and listening to what do we need to do? What is important now? What do we do? And then we start to work on that. Even sometimes I know last. Week the week before when we presented the news from Liberia, and Daniela was like, oh.
Yeah, yeah, yeah.
So
And
that kind of empathy, from their side to us, and also from our side to them. I know I sent an email to do a check-in with all of you, and then Daniela wrote me back, and she said, "Look, you have me
yeah,
crying with this message." So I think it's really great what we do for ourselves, but also what we do for the women that we work with
absolutely.
around the
My
world, and
lesson
that
during Ebola, my lesson
yeah.
was that we really could like give you the funds, and you knew best how to make a difference, and you even won that prize for best civil society organization working on Ebola. So now, yeah, my colleague is already saying we should finish. Carol, thank you
Thank you
very much.
very much,
Have a very
Helena,
lovely evening, and
for
keep in
making
touch.
this possible.
We keep in touch. Bye bye.
Yeah. Bye.